Welcome everyone. This is Kat and Sean, and we decided to do an impromptu podcast on why is stem cell not offered in Canada, and why does stem cell meet such resistance. Anyway, no real format. Just an open discussion and throwing the question out there. Me and Kat both have had our own stem cell experiences, which are very different, but we both had positive results. So, Kat, why do you think stem cells not offered in Canada?
Well, I am not a conspiracy theorist. I'm not. But I think the question needs to be asked. Stem cell is not new. People can't say they're waiting on research. It's been around for a long time. I did mine over 18 years ago. And at that point, it was already happening for about 6 years. And the reason I found out about stem cell was my friend actually went to see a doctor in Ottawa, Dr. Freeman, and he recommended to her, he said, I can't do something for you here in Canada. Try Israel. And so she went, had a good result, and I followed her. I thought, well, if a top neurologist in Canada is sending people to Israel to this place, I thought, well, it's good enough for me. And I was 35. I remember I went for my stem cell on my 35th birthday. And it's not controversial. I'm not using fetal cells. I use my own cells from my hip, the mesostromal chimal cells, which were grown. And then the thing is that's interesting is that Israel wouldn't allow my stem cells to be reinserted. So the Dr. Slavin, who I went to see in Tel Aviv, he was allowed to take things out of me, but not put them back into me. So I had to go to Greece. And I had a really pretty horrific experience. So my question is, why am I having to go overseas? Number one, spending a small fortune. Number two, the hospital in Athens would not be the standard that, I mean, people were smoking on the wards. The procedure was, she didn't even wash her hands, the doctor, before doing a spinal on me. And, you know, it was pretty horrific. And that was the length we have to go to. It's almost like the backyard abortions, you know, that we have to go to other places to get this much needed treatment to basically save our lives. And the question is why? Why? When it seems to be common knowledge, not even common knowledge, but I think the research is there that stem cell does help, it does halt, it does reverse. So why, if all these things are true, is stem cell not being offered as almost a first line treatment? In Canada, I mean, I was more of a patient in Australia. I'm an Australian Canadian, but it was not offered. In fact, when I told my neurologist I was going for stem cell, this is like 18 years ago, he goes, "Oh, I don't know much about it. And from what I hear, though, it doesn't work." And that was it.
18 years ago is a long time too. Stem cells have come a long way. The application, the administration of them have come a long way in 18 years. I went
So,
in
yeah, how did you
2022.
find it? Uh-huh.
I met a lady here in my province. I live in Saskatchewan, Canada, and there's a lady here who had progressive MS for over 20 years, and she would go to India and get treated there.
So
And
did you
her,
ask your doctor though for stem cell? Did you ask your neuro?
um, I did not in the beginning, but as I started to investigate and research more, and then I chose a non-medication route. I chose just pure diet and lifestyle, and went non-medication. And then when I started to discover this um, stem cell option, and I would discuss it with him, he would recommend HSCT, which to the tune of $80,000. Of course, money I didn't have,
Oh, so
and
that you're so are you sorry? Are you saying your neurologist did tell you to do AHSCT? And
he
where was he? Was he going to take the money or trying to send you overseas for it?
he was going to send me to Mexico, and he but he said he did not recommend it at all. But if I couldn't be talked out of it, this is what he did recommend. I didn't have the money, nor was I interested in anything with chemotherapy involved.
So why did he not recommend it? Do you remember?
He didn't feel it worked. He didn't. It didn't meet sort of his standard of care, I guess. He didn't feel it would help me, and he also said that the best you could do is it could stop progression. And I already at this point had already met somebody. Not only did it not only stop progression, but it reversed her condition. So this lady that I would meet would go to India in a wheelchair and left a wheelchair in India. So 13 days after she arrives in India, she would go into a wheelchair onto the airplane and come back to Canada and walk off the airplane. And
Yeah, I
10
know I
years
couldn't.
later, she's still doing
Yeah.
great.
For me, I went to Israel and then had my stem cells done in Greece in the end, but I walked in, I limped in, my left leg not working at all. You know, I'd step and then have to drag my leg. And then afterwards, I was back running again. And so it wasn't a cure. I ended up having a relapse 6 years later, but it certainly reversed a lot of my disabilities, and it was absolutely 100% worth it. What makes me really angry and frustrated is when I tell people on your Facebook group, Multiple Sclerosis Resources and Information, that
Education.
stem cell and education, sorry. Um, when you share stories of healing, it's amazing the amount of people go, "Oh no, you can't heal, you can't get better." It's like, actually, you can.
You can.
And the fact that neurologists are they gatekeeping it? Who's stopping it? Are they not? Don't they have Google,
Yeah.
ChatGPT to see the studies, see all the people that are actually getting better from stem cell that are number one, reversing disability, number two, stopping progression. I did a search on ChatGPT before, and it said I think 60 to 70% of people who did AHSCT had no disease progression after 10 years. It basically stopped the disease. But it seems that before you can get it done, you have to be so far gone that it's so hard to get things back. And this is my argument. Why is it not offered as a first line treatment? Is it invasive? Yes. Does it carry risk? Yes. But should that not be up to the patient to undertake that risk if the risks outweigh the benefits outweigh the risks?
I don't see it being risky. I there's a risk. Everything has a risk. Taking medications has a risk. If you do medications for 20 years and it doesn't help you, you're in trouble. And anything you could have done in that 20 years time frame has passed you by. And now you're very disabled. And anything you could have done, like I said before, now is past. So it's very risky to do medication, trust in it for 20 years to find out it didn't work.
Yeah.
So
And that's what
stem cell is not risky. It's not.
Oh, look, I wouldn't say it's not risky. I think with any procedure carries a certain amount of risk. Absolutely. I agree. I mean, you can't say you don't ever know what is going to happen to anyone's body. Same as taking a drug. You don't know what's going to happen to you anytime you do anything to yourself. You don't know. But my point is why, and people will say the cost of stem cell. The cost of stem cell is dirt cheap in comparison to any DMT. Dirt cheap.
That's true.
And there's no reason why it should not be at least floated as an option for people instead of like I think a lot of people say you have to fail like two DMTs before it's
Yeah.
offered. And I think in Canada it's only offered in Ottawa from what I'm hearing within your group. A lot of people are commenting on the post. So why is it only offered in one place in Canada? I mean, how many patients in Canada have MS?
There's well, where in my province is the highest rate of MS in Canada, not and in the world. So we have the bragging rights to have the highest rate of MS in the planet, on the
And do you
planet.
have any idea how many people that is currently?
Not offhand. No, I think it's per capita anyway.
Anyway,
So
it'd be interesting to see you all have to pack up and move to Ottawa if you want to. But why is it not offered more regularly? And so this is my thing. I feel that, like not being a conspiracy theorist, but is it the drug companies? Like, where is that roadblock where a neurologist would not do it? And I'd actually challenge any neurologist with MS to not do it, to
yeah,
not find the evidence why they shouldn't do it.
I would
If
think.
they
I
would do
would
it for
think
the
if
child.
I would think if the people who, like a drug company people, if they all had MS, then they would be different. But it's always healthy people who seem to have the best advice for people with MS, which has
Hmm.
always drove me a little bit crazy. Is that
Yeah.
I've gotten some of the best advice from people that don't have MS, but none of it works.
Yeah.
I
Well,
think
as
the
far as
big,
I'm, sorry, go ahead.
I think the biggest thing is just lack of desire. That if you if
Desire?
if stem cell helped one person, just one, and it goes, look, they took stem cell, and that's better. You would think that there would be a flood of people, doctors and researchers and whatever, to flood to that person and go, okay, we found something that worked. Let's figure it out. And so we can offer to all the other people with MS. But they don't. They
And
just
there
don't.
is. I mean, there's so many people. There's so many people. You can look on here,
There
and I'm
is, yeah.
sure after our discussion, we'll have a lot of people hop on and say how stem cell has helped them. And I'd love to hear from the people that it didn't help. But from my research and from what I'm discovering is that pretty much everyone that does stem cell, they it stops their disease and no one regrets it. I know I had a discussion with Matthew Embry. I was on his podcast, MS Hope, and I believe you were too recently.
Yeah, it was,
And he
yeah.
said to me, if he had a relapse, he'd be straight to Mexico for a stem cell. And I mean, this guy has talked to all of the experts. He's seen it all with MS. And that's where he said, yes, the diet's important, all that stuff's important. But once that disease is active, so I'm so for stem cell, and I'm so angry that I get attacked. And I don't know about you, but I find I get attacked because when I say I healed and stem cell had a lot to do with it, people are like, "Oh, aren't you lucky? We can't all afford that." But why should we? Why is the drugs handed out, but not something that will actually work? So I think
Yeah,
it's really important that we actually stand up and start demanding some answers about that.
100%.
Because
I
I
can't
am
believe you guys
mad.
started.
I'm mad.
Yeah, for sure. And you should be. Well, and the whole MS community should be. Because it's a
Yeah.
horrible disease. It's just a horrible disease on so many levels. And all diseases are horrible. But MS is very personal to both of us. Obviously, we both have it. But I think the number one reason I started my group was so that I could have a group or a place where I could tell my story and not get kicked off or not get treated poorly. I would
So
go
what
on other
happened? So
groups.
are you trying to say what happened? Like, how did that happen?
Well, I would go on other groups. I got back from being treated, and then I sort of started to build my life back up because I'm well again. And then I started going on Facebook groups, MS face groups. Said, look, I did this, and maybe you'd be interested or whatever. And the kickback was took my breath away. I was just so shocked that why isn't everybody clamoring to find out? They need what I did, but instead of asking me what I did, and not everybody, some people are very interested, and some of them were, but lots of times it's like you're scamming, you're lying, you're and worse. I was just
And
shocked.
and for me, I'm better. I am so much better. I'm MS almost 30 years. I'm running, I'm climbing volcanoes. I'm good. But I feel I needed to come back into the MS community because I have a moral obligation that I thought if I've got to tell people how this has helped. And like you said, when I put myself out there, a lot of people are like, great, what did you do? But then there's the other half that almost are angry about it. I know when I got back from Israel and I was running again, I went to my neurologist and he had me lying on the table, and he said, lift your leg, and I lifted it. And I thought, oh my God, I'm so excited for him to see that I can do this now. And he just shook his head and said, you're getting worse. You need to be on DMTs. And I was like, what? And then I didn't go back there for over 5, 6 years. And I did end up having another attack, but 6 years I didn't see him. And then he called me and he said, can you tell me what it was that you did or where you did it? Because I have some patients. And I think a lot of times neurologists don't want to see it. They just have this idea that, no, it's not going to work. But those ones who have seen, obviously these neurologists have patients that have been to Mexico, who have been to India, Russia, and seen these incredible results that people are having. They need to be standing up and saying, no, we need to be offering these to people, not when it's too late, when people are in wheelchairs and can't walk and lost their livelihood. It's got to be from the beginning as an option.
The sooner you do stem cell, the more effective it's going to be. If you wait, there's certain things that it's called stenosis. If longer you wait, the more the sort of scar tissue builds up around that area, and it can't be repaired. So if you do stem cells sooner, the better.
I know for me, I was already 10 years in when I had stem cell, and I had a considerable amount of damage, and it took me, probably nearly 7, 8 years to be able to run again, nearly 10 years to be able to run again. And I think a lot of it was my brain just making new neural pathways. It probably wasn't healing. And I often think, well, what if I had access to stem cells from the beginning? I wouldn't have had those 10 years of damage, just constant attacks. And it's frustrating, and people can't afford it. And it doesn't make sense because it's not an expensive procedure. This is not about stem cell costing a lot of money. It's about not giving the money to the drug companies, who are now going to be without a $4 billion if they do stem cell.
Yeah, absolutely.
Come on, let's wake up.
Where I went is the procedure that I went is a better procedure than HSCT, no chemo, and it's half the price, less than half the price of HSCT. And I would recommend it, and I have recommended it ever since I've done it. The person who told me about it, she's now over 10 years out and with clean MRIs. And I'm now have clean MRIs too. I'm going on 4 years.
Wow.
And I'm fully functional. I'm remarried. I'm living the dream again.
Well, I had an MRI about 15 years ago, I guess, when I went for my stem cell, and 18 years ago. And to be honest, I've never looked at an MRI since. But I did have a neurologist because I had a slight, relapse after 13 years of being perfect. And all the neurologist said to me, because I'm like, I don't need to know. He just said, your brain looks amazing. And he couldn't even see a relapse. So, I don't know. But I think we really need to open up this conversation and really say to people, we need to be stronger and really start to look at the evidence behind stem cell, and not to wait, and really push against these gatekeepers that are stopping us being able to do it. It shouldn't be just people with money that can do it. It should be available to everybody.
100%.
Yeah.
If there is a cure, it should be available.
Yeah. It's so good to chat, Sean.
For sure.
Yeah.
And,
I think we should chat about how diet and mindset have helped us as well.
That's the other thing. There's so many things that cause what I think causes MS. But in the next podcast, we will dive into diet and lifestyle, Kat, and we can talk about the other sort of practical things that we do to reverse MS in our lives and just stay practical. Till next time.
Yes.